What is an eating disorder? Eating disorders are serious conditions related to persistent eating behaviors that negatively impact your health, your emotions, and your ability to function in important areas of life. Most eating disorders involve focusing too much on your weight, body shape, and food, leading to dangerous eating behaviors. Eating disorders can harm your heart, digestive system, bones, and teeth and mouth, and lead to other diseases. Full-blown eating disorders typically begin between 18 and 21 years of age, according to the National Eating Disorder Association. The association estimates that between 10 and 20% of women and 4 to 10% of men around this age suffer from eating disorders, and the rates are on a rise. They might become preoccupied with weight, food, calories, carbohydrates, fat grams, and dieting, refusal to eat certain foods, appears uncomfortable eating around others, has food rituals, skips meals or takes small portions, withdrawal from usual friends and activities, frequent dieting, extreme concerns with body size and shape, and extreme mood swings. Noticeable fluctuations in weight both up and down, stomach cramps, menstrual irregularities, difficulty concentrating, dizziness, fainting, feeling cold, sleep problems, cuts, dental problems, dry skin, fine hair, cavities, muscle weakness, yellow skin, cold hands, and poor wound healing. Anorexia is a potentially life-threatening eating disorder characterized by its abnormal low body weight, intense fear of gaining weight, and a distorted perception of weight and shape. People with anorexia use extreme efforts to control their weight and shape. Young people ages 15 to 24 with anorexia have a 10 times the risk of dying. Males represent 25% of the individuals with anorexia. Dramatic weight loss, dresses in layers to hide weight loss or to stay warm, preoccupied with weight, food, calories, fat grams, and dieting, makes frequent comments about feeling fat, resists or is unable to maintain a body weight appropriate for their age, height, and build, maintains an exercise regimen despite weather, fatigue, illness, or injury. Treatment for anorexia is therapy, antidepressants, and the Dalzy method. Bulimia is a serious, potentially life-threatening eating disorder. When you have bulimia, you have episodes of binging and purging that involve feeling a lack of control over your eating. Between 1.1% and 4.6% of females and 0.1% and 0.5% of males will develop bulimia. Bulimia occurs in 2% to 5.4% of adolescent. Disappearance of large amounts of food in short periods of time, frequent trips to the bathroom after meals, signs, smells of vomiting, presence of wrappers or packages of laxatives. Drinks excessive amounts of water, has calluses on the back of hands and knuckles from self-induced vomiting, and has dental problems. Treatment for bulimia is SSRIs, psychology, therapy, and antidepressants. The best contributor to development of eating disorders is the social-cultural idealization of thinness. By age 6, girls start to express concerns about their own weight or shape. 40 to 60% of elementary school girls are concerned about their weight or about becoming too fat. Of American elementary school girls who read magazines, 69% say the pictures influence their concept of the ideal body shape. 47% say the pictures make them want to lose weight. Up to 40% of overweight girls and 37% of overweight boys are teased about their weight. Over one-third of female athletes reported attitudes of symptoms placing them. 91% of athletic trainers reported dealing with athletes with eating disorders. 93% feel that it needs an increased attention. 90% of college students diagnosed with eating disorders also belong to a fitness facility. A study involving fitness professionals revealed that 100% of the participants believed that it would benefit them to further education guidelines for identifying and addressing eating disorders. There is a strong link between exercise compulsion and various forms of eating disorders. Between 40 and 80% of anorexia patients are prone to excessive exercise in their efforts to avoid putting on weight. Two-thirds of people with anorexia also show signs of anxiety disorder several years before they start their eating disorder. There is an elevated risk for obsessive-compulsive disorder among those with eating disorders. Up to 69% of patients with anorexia and 33% of patients with bulimia have a coexisting diagnosis of OCD. A study found that 94% had a co-occurring mood disorder, mostly major depression, 56% were diagnosed with anxiety, 20% had obsessive-compulsive disorder, 22 had post-traumatic stress disorder, 22 had alcohol and substance use disorder.